بسم الله الرحمن الرحيم. الحمد لله رب العالمين، وصلى الله وسلم على نبينا محمد وعلى آله وصحبه وسلم. أقدم لكم نفسي تدريسي محمد اسماعيل عبد الله، بكالوريوس طب وجراحة الفم والاسنان، ماجستير في طب الاسنان الوقائي، تدريسي في كلية طب الاسنان جامعة الانبار. طبعا محاضرتنا تخص طلاب المرحلة الرابعة في مادة طب المجتمع. Our lecture about control of infection in dentistry. طبعا موضوع control of infection موضوع مهم جدا للطلبة وللأطباء، لأن هذا جدا متعلق بحياتنا اليومية، وخصوصا في الدنتال كلينيك. ممكن all dental team exposed to the infection as well as the patient. فدراسة هذا الموضوع مهم جدا، يجب أن نتعرف على الانفكشن أو كيف نسيطر عليه. and how can you prevention from the infection. Control of infection. This picture shows the hand of human. طبعا هذه الصورة شوفنا أنه الهاند of the human، سواء بالنسبة للبيشنت أو بالنسبة للدنتال تيم worker، يعني تحتوي على many type of microorganisms. لذلك the cleaning of the hand very important، يعني قبل الشروع بالعمل. The objectives learn about the basic principles of infection and disease. إذن الهدف منه هو معرفة أساسيات الانفكشن والديزيز. Understand how disease is transmitted. إذن الهدف أيضا من هذه المحاضرة معرفة وفهم كيفية انتقال المرض. Review infection control measure. Concepts of disease transmission. Infection is the multiplication of infection agent, microorganism, within the host. Invasion is the process in which microorganisms enter the host cell. Virulence is the ability of agent or microorganism to cause disease. إذن عندنا الانفكشن هو multiplication of microorganism. The invasion, the ability of the microorganism to enter the host cell. Virulence, the ability of agent to cause disease. Chain of infection. Agent, reservoir, borel of exit, mode of transmission, borel of entry, susceptible host. إذن chain of infection, the agent, reservoir, borel of exit, mode of transmission, borel of entry, susceptible host. The infectious agent pathogen like microorganism, bacteria, virus, fungi, and protozoa. Normal flora. عندنا normal oral flora, normal skin flora. Colonization, virulence, and susceptibility. reserve. Animate sources like human, animals, insects. Inanimate sources like soil, water, food, medical equipment. Pathogens or microorganisms need a proper environment to survive. إذا الميكروأورجانيزم يحتاج إلى بيئة للعيش. فالعناصر هذه البيئة هي الفود، الأكسجين، water, temperature, pH, light. Carriers, toxins like exotoxin and endotoxin. Portal of exit and entry. الميكروأورجانيزم ممكن أن يدخل للهوست إلى الهوست tissue through the skin and mucous membranes, or through respiratory tract, through urinary tract, also through gastrointestinal tract, reproductive tract, and the blood. And these are of portal of exit and entry of pathogen. Mode of transmission. طريقة الانتقال إما by contact, direct or indirect contact, or through droplets, airborne, vehicles, or vectors. Susceptible host. Susceptibility, resistant to infection. Factors which influence the susceptible: age, nutritional status, chronic disease history, trauma, and smoking. The acquisition means of pathogen. Direct contact, skin to skin or skin to mucous membrane. Indirect contact, through droplets or body secretion. Airborne mechanism, inhalation of pathogen, or through vehicle-borne mechanism, contaminated food or contaminated water. Vectors like animals or insects. Definition of terms. طبعا هناك بعض المصطلحات تخص الانفكشن والديزيز should be known. يجب أن نعرفها نتعرف عليها. Host, living animal or plant. Agent, something that produces or is capable of producing an effect, like infection. Vector, an organism, as an insect that transmits an agent from one organism or source to another. Vehicle, inanimate object, food, water, that can carry an agent from one organism to another. Disease, impairment of normal functioning, manifested by sign and symptom. Infection, the state produced by the establishment of an effective agent in or on suitable host. Host may or may not have sign or symptom. Carrier. Individual harbors the agent but does not have symptom. Person can affect others. Reservoir. Habitat, man or animal in which the agent normally lives, grow, and multiples. The common infection condition، يعني أغلب الإصابات الموجودة هي الفيرال هيباتيتس. طبعا الفيرال هيباتيتس عندنا تايب A و B و C و D و A، لكن المور كومن هو هيباتيتس B and C. Herpes virus infection like herpes simplex virus. Syphilis, acquired immune deficiency syndrome, AIDS, caused by human immunodeficiency. Tuberculosis, caused by Mycobacterium tuberculosis، اللي هو طبعا احنا عندنا مصطلح نسميه التوبركلوسيس اللي هو تي بي او مرض السل. viruses الاتش اي في virus. Then these are the common infection condition: viral hepatitis, herpes virus infection, syphilis, AIDS, TB, and HIV. Transmission of infection disease. Transmission of infection from infected patient to dental health care worker. Transmission of infection from the infected worker to the general public. Transmission of infection from infected patient to the another patient. إذن عندنا انتقال الانفكشن إما from the patient to the dental work، or عكس from the dental work to the general public or patient، or from the patient to the patient. Control of infection disease. How can you control of infection disease? By personal barrier technique, immunization, history, medical history of patient, radiographic auspices, and use of disposable instrument for patient. Type 1 of control infection: personal barrier technique. Hand washing. There is no acceptable way to sterilize human hands. There is no acceptable way to sterilize human hands. For this reason, all healthcare providers who come in direct contact with the patients must wear disposable gloves when performing intraoral procedure or any procedure take place in the dental clinic. The recommended hand washing procedure include scrubbing of all surfaces of the nail, finger, hand, and lower arm with the soft sterilized brush or disposable sponge with the antimicrobial preparation. إذن تنظيف كل الأظافر والأصابع والأيادي والlower arm with the soft sterilized brush or disposable sponge. All jewelry must be removed. كل المجوهرات المحابس يجب أن تزال من اليد. Care should be taken to avoid the overuse of a stiff bristle brush, which will cause abrasion and laceration to skin nail area. إذن نتجنب استخدام الستيف بريستل برش حتى لا يحدث فد abrasion أو laceration للسكن. The hand must be washed between the patient before gloving. Why? Then the hand should be washing between patient and other patient before gloving. Why? To reduce the skin microbial flora and prevent skin irritation by the waste product of bacteria growth under gloves. لأنه هناك يصير waste of the product of the bacteria under gloves وهذه يسوي irritant للسكن. Therefore should be washed the hand between the patient and other patient. Gloves. Gloves used for protect the dental team members from direct contact with the patient microbe. إذن حماية الdental team worker from the contact with the patient microbe. Also protect the patient from contact with the microbes of the hand of the dental team members. إذن استخدام gloves هو حماية للdental team worker وحماية أيضا for the patient. Gloves should be changed between patients and are not to be washed with the detergent at any time. إذن لكل مريض نستخدم gloves. لا يغسل gloves, not washing the gloves with the detergent solution. For each patient نستخدم use gloves. Punctured gloves should be removed as soon as possible. The third type of personal barrier technique, mask. Use of mask. Why use of the mask? To prevent sputter from patient mouth. To reduction in the inhalation of airborne particles. Mask should be changed per hour or between each patient. Mask should be properly disposed of after each use and not left hanging around the neck. Type 4 of personal barrier technique, eye wear. The eye, due to limited vascularity, the eyes, due to limited vascularity and lower immune abilities are susceptible to macroscopic and microscopic injury. Protective eyewear should be worn by all dental personnel involved in the treatment in form of glasses to prevent trauma to the eye tissue from flying droplets. Dental personnel also at risk from the herpes simplex virus and hepatitis B may be developed after the initial contamination. Protective eyewear should be available to patients as well as the dental personnel. إذا protective eyewear ليس فقط للdental team worker, also for the patient. The superimposition render the patient susceptible to failing object in the head and neck area. All protective eyewear should be cleansed after every appointment. Eyewear should be washed with the soap first. طبعا أول شيء النظارات تغسل بالصابون, then rinsed with the water ثم بالماء, and surface disinfectant can be used later. بعدين نستخدم المعقمات. Protective clothing. Protective clothing is the outer layer or covering of garments that would first be contacted by the contaminating droplets, generating from spray and speller. The garment should be worn only in the dental environment and should be changed at the end of treatment. Also should be changed immediately if soaked or spattered with the blood or other contaminant. Then review the personal barrier technique involve hand washing, gloves, use of gloves, wearing of mask, eyewear, protective clothing. Type 2 of control of infection, immunization. Immune is very important for dental team. More exposure, more exposed to the infection. Immunization. All dental healthcare workers, the dentist and the assistant, should be immunized by taking vaccine against the most prevalent infection. طبعا most prevalent infection هو hepatitis B and C. By taking vaccine against the most prevalent infections disease because they are at risk of infection. Medical history of patient. Complete screening of patient medical history must be taken. طبعا ضروري جدا أنه نأخذ complete history from the patient. Radiographic asbestos. For operator, a convenient way to prevent spread of contamination on film bag to use plastic disposable covers on bags before they are placed into patient mouth. طبعا نضع كيس بلاستيكي على الفيلم ثم ندخله في فم المريض حتى نمنع الcontamination of the film from the saliva of the patient. وهذه طبعا تعتبر حماية للأوبريتر. For patient, using plastic barrier material on the portion of cone and tube head and on the exposure switch will reduce the cross-contamination between the patients. The use of disposable instrument for patient. Also, this is very important. والآن والحمد لله موجود كثير من disposable of instrument in the dental clinic. Use of disposable items or instrument to prevent patient-to-patient contamination. Numerous disposable items are available in dentistry, which include gloves, mask, gowns, surface covers, saliva ejector tip, saliva ejector, air syringe tip, impression tray, fluoride gel tray, high-speed handpiece, your turbine, also specially used for the hepatitis, with the patient with the hepatitis, mirror, probe, tweezer. All these disposable instruments تستخدم لمرة واحدة for each patient. Now talk about sterilization of instrument. Instrument processing involves cleaning, packing, sterilization, drying, cooling, storage, and distribution of instrument. The cleaning. Pre-soaking of contaminated instrument keeps them wet until thorough cleaning can occur. This procedure prevents blood and saliva from drying on the instrument and facilitates cleaning of instrument. Cleaning of instrument, which is achieved by hand scrubbing of contaminated instrument, ultrasonic cleaning from 2 to 20 minutes is needed to clean an instrument ultrasonically. Packing. After cleaning instrument have been rinsed and dried, they are to be packaged in functional set before sterilization. Caution must be exercised to ensure that the items are dry before sterilization to prevent corrosion. This packaging protects the instrument from becoming contaminating after sterilization. Sterilization. Sterilization, it is a process of killing all microorganisms using physical and chemical procedure. Disinfection. It is a process of killing most but not all microorganisms, also by using physical and chemical procedure. Then differences between the sterilization and disinfection. The sterilization kill all microorganisms, but while disinfection kill most of the microorganisms by physical or chemical procedure. Drying, cooling, storage, and distribution of instruments. Then the sterilization process involves cleaning, packing, sterilization, drying, cooling, storage, and distribution of instruments. Follow these easy and low-cost steps to stop many infection diseases. هناك خطوات سهلة وتكلفتها قليلة تستخدم لمنع انتشار الديزيز. Cleaning your hand often. Keeping your hand clean is one of the best way to keep from getting sick and spreading illness. routinely cleaning and disinfecting surfaces. Cleaning with the soap, cleaning the surfaces, table or other surfaces with the soap, water and scrubbing, removing dirt and moisture. However, using disinfectant cleaner kills germs, giving even better protection. Handle and prepare food safely. Get immunized. Use antibiotic appropriately. Be careful with the pets. Avoid contact with the animals. Thank you for listening.